There we go. Sorry, I meant to start recording earlier. Well, we're going to feminist ethics. What is that? Ethics in the core functions. What is assessment with regards to ethics? What is policy development? What is assurance? And then there's a public health code of ethics with 12 principles, right? So we'll take a look at that in the book. Advocacy. How does advocacy play into ethics? What is advocacy? The act of pleading for supporting a course of action on behalf of a person, group, or community. As nurses, we're advocates, right? Public health nurses have a moral mandate to establish ethical standards when advocating for healthcare policy. Okay, so let's go to the book and see what's important to understanding ethics. Okay. Just going to go through my notes to see what I want to cover here. Here's your outline. There's your objectives. Okay, let's okay, here's in table 4.1, here's your steps for ethical decision making. There's 7 of them. Okay. Identify the ethical issue and dilemma. Place them within a meaningful context. Obtain the facts. Reformulate the ethical issues or dilemmas if needed. What are going to be your approaches or actions? Make decisions and evaluate. This is your summary. This is how the nursing process is applied to ethical decision making. Okay, so box 4.1 is your nursing process. Okay. Okay, we're going to review the ethical principles and theories as guides to ethical decision making. Okay, there's several. Okay, and I'm just going to identify them. You can look them up and see what their definitions are. Okay, but we need to know about utilitarianism and deontology. Okay, we need to also know about consequentialism. Okay, so there's in the study, I want to go to the study guide because the study guide has an excellent summary of these right here. Okay, I'm on page 8. Okay, right in here. Okay, utilitarianism is the ethical theory that the key that outcome is the key. Okay, so in utilitarianism, the action must justify the means. Okay, deontology is the theory that adheres to moral rules rather than duty, or duty rather than consequences. These are I would put these on a card. Okay, there's 4 of them that we need to know. You need to know the definitions of the 4 of them. Okay, utilitarianism, deontology, and these are your ethical principles, distributive justice, and consequentialism. Okay, so you have a short definition of each of those. I'm sorry, those were the theories, your ethical theories. Let's see. Then those were your ethical theories. And then here are your ethical principles that we need to know. Okay. Box 4.1. There's 4 of them. Respect for autonomy, non-malfeasance, beneficence, and distributive justice. Okay, so we need to know your ethical principles and your ethical theories related to ethical decision-making in nursing. Okay. And there's some really good boxes in here, case studies and how-tos. I would suggest you read those. Okay, and then let's talk about virtue, feminist, and care ethic theories. So that's the third part of what we need to know to have an understanding of ethics and public health. All right, there are other. We talked about the theories, the main theories above, but there are other theories that are important to consider in public health. Okay, so virtue ethics is one of them. Okay. And there's a how to apply virtue ethics in the decision process. Okay. Care ethics, virtue ethics, care ethics, which is right here. So you can read about that. Feminist ethics. We do need to know that for the upcoming exam, feminist ethics. Okay. So down here is a good summary. Feminists advocate economic, social, and political equity. Okay. And another box, how to apply care ethics, how to apply feminist ethics. So I would suggest that you read through those. Okay. Ethics and core functions of public health nursing. Okay, so in chapter 1, we discussed that the 3 core functions of public health nursing were assessment, policy development, and assurance. Okay, this is an excellent summary of those 3 core functions of public health nursing. I would highly suggest you take a look at that. That is on we're on page 57. Okay, look at the sections of assessment, policy development, and assurance, which are the 3 core functions of policy of public health. Okay, because in this section, it brings in the discussion of ethics, why ethics is so important to support the core functions of public health. Okay, so assessment, policy development, and assurance. Okay, that's on page 57 and 58. And then, of course, we have our Healthy People 2020 objectives, and they're related to access to health services in this particular chapter. Okay. And there's only 2 of them. But we need to know those. If you're asked about objectives related to access to health services, the only correct answers are either one of these. Okay. There may be lots of other objectives that we can think about or we can create that would be applicable to access to healthcare. But if you're asked about Healthy People 2020, these are the only 2 that would apply. Has everybody heard of the Nursing Code of Ethics?
Yes, ma'am.
Okay. Right. Each specialty has a code of ethics. So public health has their code of ethics. This is a generic section here, but know that code of ethics for nurses is an interpretive statement and applies to nurses in community health. Right. Although the emphasis for each type of nursing sometimes varies. So hospice nursing has a code of ethics. School nursing has a code of ethics. Home health nursing has a code of ethics. Okay. And here's our public health code of ethics. Okay. Or about our public health code of ethics. Right. Which was created with the assumption that all humans have the right to adequate health resources. And it contains 12 principles related to the ethical practice of public health. Okay. It includes the values and beliefs that focus on health, community, and action within each of the 12. Okay, and here they are right here. Okay, so box 4.3 is important to know and understand of how ethics or how public health is supported, or how ethics plays its part in public health. Okay, so I would know those. Okay, and actually you should. I mean, you don't need to memorize them, but I want you to review those. Okay, because this is the whole backbone of public health. Okay. And then, of course, let's cover our levels of prevention related to ethics. Okay. Well, primary. One of the things I suggested to several students this week that were having a hard time with primary, secondary, and tertiary is to really go back, and really go back to these chapters we're covering and really get into those healthy people 2020 boxes, and especially your levels of prevention boxes, and read them and reread them and try and have increase your understanding of primary, secondary, tertiary to all these different topics we're covering. That would be my suggestion. Okay, so primary prevention related to ethics would be to use your code of ethics to guide your nursing practice. Right? Do we understand? Why is that primary?
Education.
Yeah. Yes. What's the other big word we talk about in primary? Prevention.
Preventative.
What?
Prevention. Oh, we just crossed speakers. I said preventative.
Yeah, preventative. Exactly. Right. So if you need to be aware of your code of ethics, and if you're practicing within your code of ethics, then you're preventing any possible issues of practicing outside your scope of practice. Secondary. If you're unable to behave in accordance with your code of ethics, maybe you speak in a way that does not communicate respect for a client, you take steps to correct your behavior. You could explain to the client your error and apologize. Okay, so this doesn't scream screening, but what it does, for me, which I always take screening to a different level and say early identification and early intervention. Okay, so this would be an early identification that there was an issue. You did not speak in a way that communicated respect for the client. So we have to, early intervention, take steps to correct it. Does that make sense? And then tertiary, You have treated a client or staff member in a way that is inconsistent with your ethical practices. Seek guidance and other choices you could have made. So this tells me that you're probably dealing with a staff member or an employee who has already crossed over that line, right? And has either been unethical or has a pattern or whatever, and you're having to work with that employee on a tertiary level, knowing that things have already happened, right? So I don't know, what would a tertiary level prevention be for this particular situation? Maybe re-education of what the code of ethics are, right? Maybe discussing potential negative outcomes that come with not following the code of ethics. What else? Maybe firing the employee if they can't work within the code of ethics, right? Make sense? Okay, advocacy and ethics. I would have a read through this section. Advocacy, we are advocates for our clients in public health nursing and community nursing. Okay. We may, especially when it comes to ethics, advocacy is, very important because we may be advocating for clients in all sorts of ethical situations, whether it be end-of-life decision-making, family involvement. Just think of the numerous scenarios that we potentially would be acting as an advocate for our client or the family or whomever. Okay. One of the things I think about is maybe we're advocating for, with a doctor on behalf of a patient to try new medications or here's what we see in the home. Maybe we could change the plan of care to include this, whatever you think. You're advocating, you're working with the clients and then advocating on their behalf. Are you advocating with the insurance company? Are you advocating with a physician? Are you advocating with the family? But you're advocating. Okay. Okay. So in summary, I want to cover the, so in summary, this is what is important to know. Ethical principles and theories, ethics and core functions. We went through that. The 12 steps of the public health code of ethics. Okay. I need National Research Act. We need to cover where. Okay. There is the National Research Act that we need to know what the definition of that is or of what they support. So I keep moving on. If anybody wants to go back to this chapter and let's see. I'm going to have to come back to that. I don't want to get bogged down with that. Has anybody read through this chapter and knows where that I should have highlighted it. Anyway, we need to be familiar with the National Research Act. So more info to come on that, but I need to find that information. Was it in our, let's go look, hang on. Was it in our PowerPoint? Feel free to be looking for this while I'm trying to look for it as well. It will probably save us some time. Oh, I know where I can find it. We'll find it right in the study guide. Let's see. Right here. Okay. So the National Research Act established the National Commission for the Protection of Human Subjects, as outlined in our ethical principles that are to be followed. Okay. The ethical principle of respect. So we need to know that. The ethical principle of beneficence, right here. And the ethical principle of justice. Okay. So that's what the National Research Act. Well, the National Research Act established the Commission for Protection of Human Subjects. And it outlined the principles that it operated under. The ethical principle of respect, beneficence, and justice. Okay. So while we're here on the study guide, here's your utilitarianism, deontology, distributive justice, and consequentialism. And then here's your feminist ethics. Tells you what, gives you a summary of that, your virtue ethics, right? Your non-malfeasance and your caring ethics. We just covered all of that. Okay. So do we have a good understanding of chapter 4? Chapter 4 is a lot of definitions. Okay. Let's go to chapter 5. Okay. Cultural influences in nursing and community health. Okay. You can read through your objectives, but we do know that U.S. population is becoming increasingly diverse, right? Nurses and clients often come from different cultural backgrounds and may not recognize or understand the differences, right? Nurses need to be able to provide culturally competent care. So I will ask you guys, what is culturally competent care? This is a biggie for me.
Are you asking us?
I'm asking you. Yep, I am.
So you need to know about the culture. You need to be aware of different cultures.
You need to ask them what their preferences are.
Okay. Anybody else? What happens if you're culturally, what potentially are some barriers if you're culturally incompetent?
You may give inaccurate care or be judgmental.
Exactly.
They don't cooperate, which could affect their outcome.
Exactly.
And to go along with the customer service part, you definitely will offend them.
Yep. Exactly. Excellent. Excellent. So the two groups of people that we talk about are immigrants and refugees. Okay. So when we don't need to really cover that. Okay, here's some immigrant categories. Okay, we have illegal immigrant, refugees, non-immigrants, and unauthorized immigrants. Okay, so now we're specifically talking about immigrants. Factors to consider for providing health care for immigrants. We need to understand this. To be able to understand culturally competent, providing culturally competent care, we must understand what factors are to consider for providing health care for immigrants. So you need to have an understanding of slide 6. Okay.
It's page 67 in the book.
Okay, yeah, we'll get there. Yeah, thanks, Danielle. Yep. I'm just going through the outline of the book. So we need to understand the difference between culture, race, and ethnicity. And there is a summary of each of those on slide 7. What is cultural diversity? Right, diversity is represented among populations, right? What's the variation that's represented among populations based on several things: lifestyle, ethnicity, race, interests, across place and place of origin across time. Also includes the awareness of the presence of differences among the members of a social unit or group. And then what is cultural competence? Okay, we have 4 principles of cultural competence, and they're outlined for you right here in slide 9. Okay, really important. Care is designed for a specific client. Care is based on the uniqueness of the person's culture and should include cultural norms and values. Care includes self-employment strategies to facilitate client decision-making in regard to their health behavior, meaning we want to involve the client in the planning process, in the nursing process, planning, the whole process. Care is provided with sensitivity and based on cultural uniqueness. That is the basis for cultural competent care, your 4 principles. And key reasons nurses must be culturally competent. So have a look at that. How do we develop cultural competence? Okay, really important slide here. There's 2 principles, there's 3 stages, and there's dimensions of each stage. And then the concepts of cultural competence. The concepts are: we must be aware, we must be knowledgeable, we must have skill, we must involve ourselves in encounters and have the desire to do so. Okay, and then the dimensions of cultural competence: preservation, accommodation, repatterning, and brokering. I'll show you where those are in the book. We need to have an understanding. What are some inhibitors to developing cultural competence? Well, there's an excellent list: stereotyping, prejudice, racism, cultural blindness, cultural imposition, cultural conflict, cultural shock. So as we're doing our nursing assessment, from a cultural standpoint, right, here's some of the topics or issues you might want to talk about with the client as part of your assessment. Okay, that's on slide 15. Gathering information about all of these will help identify what the issues are, what the plan of care should be. Okay, 2 phases of a cultural assessment are data collecting and organizing. Okay, and here's some good to-dos for when you're conducting a cultural assessment. Be aware of the environment, know about community social organization, Know the appropriate questions to ask. Talk with cultural leaders. So again, what we've talked about in past classes, doing an environmental assessment, doing a safety assessment, doing a community assessment, doing an educational assessment. So this chapter takes us to doing a cultural assessment. Okay, and this is really important here. Although cultures are not the same, all cultures have the same basic organizing factors, right? What's the communication of the culture? What are the space expectations? Social organization, time perception, environmental control, and so on. Okay, so these are the common foundational factors with each culture. Okay, culture and socioeconomic status. We know that members of minority groups are overrepresented on the lower tiers of the socioeconomic ladder. Right? We also know that poor economic achievement is also a common characteristic among populations at risk, such as poverty, homelessness, migrant workers, refugees. And then certainly our nursing judgment plays a huge role in how we view these groups. And so lastly, 5 principles of a culturally competent organization. Okay, here's how you want your organizations to function. Okay, if you're going to be a culturally competent organization, here's what you want. You want to value diversity. You want to be able to conduct a cultural assessment. You need to understand the dynamics of the different cultures. Institutionalizing cultural knowledge and being able to adapt to diversity. Does anybody work in areas now that are working your workplace? Anybody work in places that are very culturally diverse? And how do you educate yourself? What do you do? I'm looking for some dialogue here.
The hospital.
Pardon me?
I work at the hospital, so you never know who you're going to get.
Mm-hmm. And as you work with diverse clients, Mary, how do you educate yourself on being culturally competent with the patients you're taking care of?
I go in with an open mind, and I just don't form judgments or anything like that. I just go in and meet them, and I get what they give me, and I learn who they are and what they like.
Okay. Great. Anybody else want to contribute to the conversation? Okay. So we just went through all of this in our outline. And so I would, let's see. Again, we need to understand the difference between immigrants and refugees. Okay, so immigrant section is on page 66. You need to have a look at that. And there are some differences. A lot of the issues are going to be the same. But there are going to be, for example, refugees. Think about refugees. They may be coming from war-torn countries, right? They may have seen horrible things. They may have been tortured. They may have family members who've been killed. Okay. Here's the refugee section here. It starts on page 68. Okay. All right, and this is what I was just talking about. Unlike immigrants, refugees may have left their homes as a result of disaster, may have led to physical, psychological consequences. Some may have been tortures, others may have lost family members in horrible ways. Okay? And the most important thing to remember about refugees, first and foremost, what the first thing we should be assessing with them is what kind of support they need for their emotional and psychological consequences that they've come from. Okay? Okay, so they may need their resources primarily maybe mental health and therapy to start out with. Okay, so I need for you to take a look at this section right here on refugees on page 68. And then on page 66 discusses the immigrants. Again, a lot of the same challenges, but there are some differences. Okay. And then here's your culture, race, and ethnicity section, right? The concepts of culture, race, and ethnicity influence our understanding of human behavior. These three terms are often used incorrectly. Nurses need to understand the meaning of each when providing culturally competent care. So I would have a look at these three terms and just read a little bit more in depth about what each of them mean. Okay, and we're talking page 68 through 69. Okay, for those three. And then cultural diversity. What is cultural diversity? We just talked about this in the outline. Cultural diversity refers to the degree of variation that is represented among populations based on several things, based on lifestyle, ethnicity, race, and interest across the place and place of origin across time. We just went through that in the outline. Okay, it can also include social class, gender identity, sexual orientation, physical disabilities, abilities or disabilities, as well as changing populations. And then here's, although cultures are not the same, cultures have the same basic organizing factors. Okay, we just went through that. Okay. This, I'd like for you to definitely have a look at table 5.1. You may be given a scenario from, I'd like to focus on these two. I'm going to make it a little bit more focused for you. I'd like you to focus on the Hispanic section and the Native American section. Okay, so these are some differences, cultural variations among selected groups. Okay, we have 4. I want to focus on 2. Okay, so what does verbal communication look like with Hispanics and with Native Americans? For example, Hispanics, expression of negative feelings is considered impolite. With Native Americans, low tone of voice is used, and the listener is expected to be attentive. So I want you to focus on verbal communication. You may be given a scenario and asked which culture. Okay, verbal, nonverbal. These are what I would like for you to study. Family organization. Time. So for example, with Hispanics, presently oriented. Interestingly, with Native Americans, often past oriented. So think about this for a minute. If they're past oriented, say you're working with a Native American family, right? And they're past oriented and they need whatever health issue they went to be seen for, they need several follow-up visits. down the road. If they're often past oriented, might they need some assistance with scheduling those appointments ahead of time? Does that make sense? They don't have the future focused. Okay, so that's just a scenario or an example I give you. Okay, if they're past oriented and we're asking them to plan for the future, we as community nurses may need to assist them. Okay, the other three are present oriented. Another important topic, what is their perception of health? Well, with the Hispanic population, balance and harmony among mind, body, and spirit and nature. Okay. And you can read the Native American. Another important topic is how do they both see alternative healers? Well, medicine man, shaman. Okay, for Native American. So for example, let me give you another scenario. Let's say they're coming to the clinic for a visit, Native American, and they bring their medicine man with them. Should they stay in the room to participate in the visit, or should you put them in the waiting room? I'm asking, somebody answer.
Allow them to participate.
Right, why? It's part of their culture. It's one of their cultural norms. It's part of you being culturally competent, culturally sensitive, right? Okay, so those are the areas to focus on, okay? And then the rest of this chapter just goes through all of what we talked about as far as how to become culturally competent. But there's a few areas I want to focus on. One is levels of prevention. I want to go through these. I'll never miss an opportunity to go through that. So here, levels of prevention are related to cultural differences, because that's the chapter we're covering. In particular, cultural differences with regards to hypertension, stroke, and heart disease. Okay, so primary, provide health teaching about balanced diet and exercise. Why is that primary?
To prevent the disease earlier.
Mm-hmm. Prevention before anything even happens. Secondary, teach clients or family to monitor blood pressure, teach about diet, keeping in mind that the client has cultural preferences. Talk about health beliefs and cultural implications, such as the use of alternative therapies. Make sure alternative therapies are compatible with any medications. So again, you're doing a screening, right? You're doing a survey, you're doing an assessment. Right? Early identification. You're trying to identify who might be at risk for hypertension, stroke, heart disease. Right? So you're showing them how to monitor their blood pressure, teaching about diet, right? Keeping in mind their cultural preferences. And then tertiary, let's assume they have high blood pressure. If the blood pressure cannot be, so they already have it. Blood pressure cannot be controlled by diet. Refer the client to a nurse, to a physician or a nurse practitioner for medication, right? You might be advising them to engage in a cardiac program. Do you understand the differences between the three here? Because if you don't, I want to go, we can review them again. There were several missed questions from lots of students with regards to prevention questions. So I really need to make sure you guys have an understanding and can apply each level of prevention to each concept we're talking about, or each topic, each chapter. And that's why I'm suggesting you go back and read through these in each chapter. And here is,
Can I ask a question?
you bet.
Okay, so on the table that we were just talking about, 5.1.
Yep.
And it might be a subtle difference and I'm just not. It says under the Hispanics column, avoidance of eye contact is usually a sign of attentiveness and respect.
Mm-hmm.
But on our study guide, it says clients who are Hispanic expect direct eye contact.
Oh, okay.
I'm just, they may expect it. It doesn't mean that
okay.
it's not expecting it, and how they interpret it are not necessarily the same thing, but I'm just wondering.
Okay.
Um,
Then I'll take a look at the study guide because it should
Okay.
be, we should be teaching from the book. So that may need to be updated. Can you, when we get to the study guide in that section,
Okay.
or just let me know where that is.
Okay.
Okay, or just stop me and I'll make sure I highlight it so I can get that corrected. Thank you for
Okay.
pointing that out.
Sure.
The rest, underneath table 5.1, it goes through each of the sections. Okay, communication, space, social organization, what each of them are. Okay. Culture, diversity, and social determinants of health. Okay. We talked about this in the outline. We know that socioeconomic factors contribute greatly to the understandings of perceptions of health and illness among minority groups, right? These groups may not have opportunities for education, an occupation, income earning, and property ownership similar to those of a dominant group. Okay. I want you to read through this. This is, let's see, right here. Let me just finish that. Okay. Socioeconomic status, which is a measure often based on income, education, or occupation, is a critical factor in determining access to health care and the development of some chronic health problems and in health outcomes. So this is a pretty powerful statement of how socioeconomic factors contribute to the perceptions of health. And then if you want to read further on that, it has more detail in here. Okay, and here's cultural competence. All right, how do we become culturally competent? Okay, so well, here's our Healthy People 2020. 2 goals, objectives related to cultural issues. Okay, so this, please know this box. Then the rest of the chapter is going through what we went through in the outline. How do we develop cultural competence? Okay, and what is cultural competence? Cultural competence, you must have to be culturally competent. You must be culturally aware. You must be culturally knowledgeable. And it goes through each of these in the book. You must have cultural skill. Cultural encounter, process that permits nurses to seek opportunities to engage in interaction. So I don't know if you're trying to learn about the Hispanic community. Maybe you go out and you participate in a food drive or an encounter, an event to learn about their culture. That's what cultural encounter means. And then the 5th is cultural desire. Okay, so there's 5 areas of cultural competence. Last one is cultural desire. And I really like box 5.3. It's a nice, nice overview of developing cultural competency and the points to remember. This is kind of a summary of the whole chapter, box 5.3. Be knowledgeable about your own cultural heritage, biases, and beliefs and values and practices when providing care. Avoid making assumptions and nonverbal cues when interacting with clients from unfamiliar cultures, right? Use a variety of sources, including the clients, to develop cultural knowledge. Sometimes they're your best teacher. Right, so please review box 5.3. Excellent summary of developing cultural competency. And then here's some culturally competent nursing interventions. Okay, so have a look at this section as well. Okay, it talks about cultural preservation, cultural accommodation, patterning, and brokering. So there's 4 nursing interventions that we must be culturally competent in performing those duties. Okay. And then I think the last section talks about inhibitors to developing cultural competencies. And this was a slide, but there was a slide about this, but this is in more detail. You know, what is the meaning of stereotyping? What is the meaning of prejudice? What is the meaning of racism? What is the meaning of cultural imposition, cultural conflict, cultural shock? So these are important to know. I put these on a card as well. You may be presented a scenario and ask, which inhibitor is this? Is it racism? Is it cultural conflict? Is it cultural shock? So please know those definitions. Then how do we do a cultural nursing assessment? Okay. Building culturally competent organizations. All right. So that's our culturally competent chapter. Anybody have any questions about that? Let me make sure I covered the sections that I needed to. Okay. Anybody have any questions? Let's move to chapter 13. Okay, and that chapter is case management. Okay. Okay. You can have a look at the objectives. All right, case management is a strategy that is used in an overarching process called care management. So case management, the big word is care management. Okay, under care management comes case management. Okay, so care management is the enduring process in which a population manager establishes systems and monitors several things: health status, resources, and outcomes. Okay, that's the big picture. Lots of things fall into care management, one of which is case management. Okay. So the building blocks used by case managers. First of all, what is a case manager? The case manager is the coordinator of care. So many areas of nursing have case managers, right? Case managers could be discharge planners. Case managers, you have case managers in your hospitals that go around and look at the patients that are being discharged, the patients that had strokes, the patient, and organizing their, at-home care. So we're the coordinators of care. Okay, here are some of the things that case managers might use: risk analysis, data mapping, epidemiological investigation of unexpected illnesses, multidisciplinary development of action plans and programs. A case manager works with the doctors and the nurses and the PT and the OT to come up with a plan of care. Okay. Definitions of case management. care management, case management. You may be a case manager, a coordinator, but you're always going to be an advocate. Okay, so here's your definitions. Case management is complex because of the coordinating activities of multiple providers, payers, and settings. You may be moving a patient from a hospital to a long-term care. You may be moving a client into a rehab. You may be working with an insurance company to get certain things covered. Okay, case management can look different, and it looks different in every situation. Okay. Characteristics, roles, knowledge, skill requirements of case managers. Okay. You can have a look at that, but what pops out to me is knowledge and skill requirements. In the community, we need to have a knowledge of community resources and financing, right? You need to have good written and oral communication and documentation skills. You must be able to negotiate with other stakeholders in the client's care, critical thinking. You need to have knowledge of evidence-based practice in that area of whatever clients you're working with. I know for me in school nursing, I was always functioning as a case manager, advocating for kids, special ed kids with physical issues, emotional issues, working with parents and the SPED staff and the principal and the speech and language. That's case management. Working on behalf of a particular student with desired outcomes. Who did I need to get involved? Okay, some tools for case managers. Community models for case management. Advocacy skills for case management. So this chapter is about how a case manager functions in a variety of different settings. You have case managers in the hospitals, case managers in hospice, case managers in home health. Okay. Right, the collaboration skills that you need for case management, right? The ultimate goal is to promote respect, understanding, and accuracy of communication of all team members. Right, everybody needs to know about the clients, their health status, what the resources are, the treatments, community providers. Everybody has to have this knowledge to participate on the case management team, and it's usually the nurse who is the leader of that team and coordinating all of the care. And then, what are some legal issues in case management? What are some ethical issues? We talked about this during our talk about the ethical chapter, right? What are some of the ethical issues that might come up in case management? Autonomy. Are we including our client in the decision-making process? Beneficence. Are we doing good for everybody? Justice, non-malfeasance. Okay, so our ethical principles and ethical theories could come into play when we're doing case management, right? What are some legal issues? Right, the provider had a duty to provide reasonable care. A breach occurred through an act of omission. The act of omission caused injury or damage. Right, this is about malpractice here. Okay, these are the 3 conditions that need to be met. These three conditions have to be met in order to discuss the liability, or in order to prove liability or malpractice, these conditions must be met. Sorry. Okay. Okay, let's see. So when we talk about case management, again, we just went through the outline, but let's go into the chapter and see what more detailed information we need to know to be able to understand the role of case managers. Has anybody worked with a case manager? Anybody have case managers in their institutions that they work in? There's case managers everywhere. What kinds of case managers do you work with? Maybe discharge planners, discharge case managers?
I
What else?
have.
What do you guys work with? What kind of case managers?
I was a case manager
Yeah.
for a COVID unit at the time.
Great. What did you do? All of what we just talked about?
Everything. I was I guess not the case manager itself, but a case manager coordinator.
Yep.
And I basically everything the role aspect of the case manager I did along with them. It's just I didn't hold the title. Yep. Because I was an LPN versus them being, went to school as a social worker.
Sure. And so what did you do?
I discharged a lot of the patients out to SNFs or other hospitals in Jacksonville, found resources if they needed to do home health care, found resources for them at home. Made sure they had a nurse set up to come out at least 2 or 3 times a week for rehab. And then even if they didn't have the funds or the insurance that will allow them to have home rehab, I will also outsource to outpatient rehab.
Well, there you go. So there's a case manager. Who's speaking?
Jocelyn.
Hey, Jocelyn. So Jocelyn just explained to everybody what the role of case management is in her setting. Okay, the coordinator of care. Okay, so from Jocelyn's experience, she had to know her resources, right? She had to know her community resources. She needed to know who the key people were to reach out to. She needed to know what her clients' needs were. Okay, so yeah, excellent. So Jocelyn, thank you for sharing. That's great. We talked about this. Case management is a strategy that's used in the overarching big picture called care management. Okay. Case management, here's your definition of it. I'll just go to capacity of systems and communities to coordinate and provide services. That's all you need to know. Okay. Healthy People 2020 has its own box for objectives used in case management. Page 224. Okay. So please take a look at that. And this is an excellent box, 13.1. This is an excellent box for how you how the nursing process looks through the case management lens. Okay, and it actually gives you gives you your ADPI on the left side. What does your ADPI look like in the case management process? And it even, on the last column, it gives you certain activities that would support that. So this is really a good box. Okay. So I don't need you to memorize this box, but you need to have an understanding of how to apply the ADPI to case management. Okay. Excellent, excellent box. And here's box 13.2. Again, nothing to memorize, but look at all the roles. Let's take Jocelyn's example. Okay. She was definitely a consultant. She had to work with outside people. She was a coordinator. She was an educator. right? She was a liaison, right? She had to be a negotiator because she was trying to negotiate services. She was certainly a client advocate. Okay, so look at all the roles Jocelyn played in just that example she gave us. We went through the tools. Okay, here's a good box too. 13.4. What are some examples of case managed conditions? Okay, so my question to you is, what do all of these conditions have in common? With regards to,
I
go
don't
ahead.
know.
No, go ahead.
No, I was just saying they are all chronic conditions, maybe.
And then what are they going to require? They're going to require coordinated care, right? They're going to require coordinated care from a case manager for several different, let's take a psychiatric conditions. Why would that need a case manager? What services, resources might they need?
Therapy, the doctors,
Maybe transportation, maybe
Medication.
finances, medication, maybe treatment facility. Same as spinal cord injuries. Think of all the coordination of care. Maybe going from a hospital to a rehabilitation, physical therapy. I mean, just think of all the different services that all these chronic illnesses may need. Okay. Okay, this is an excellent summary of why case managers, one of their primary roles is advocacy. Okay, so let's have a look at this, right? So case managers report that they are first and foremost client advocates. You have to be a client advocate to be a case manager. All right. And what is the definition of advocacy? This is the best definition I have found in the whole book, because advocacy is addressed in all the chapters, but I love this short definition of it. Nursing is the protection, promotion, and optimization of health and abilities, prevention of illness and injury, alleviation of suffering through diagnosis and treatment of human response, and advocacy in the care of individuals, families, communities, and populations. So there's to me, that's the most concise, clear definition of advocacy. You can even take the word case managers out of this, the definition of advocacy. Okay, this is a general definition. Okay. Here's another excellent box, 13.2. The nursing process and advocacy process. And to me, this box goes far beyond case management. Okay, this is our nursing, foundations of nursing. So, for example, in the assessment, what are we doing in the advocacy process for assessment? Exchanging information, gathering data, trying to figure out what the values are, planning, generating alternatives and consequences, prioritizing actions. Right? In the implementation phase, we're making decisions, supporting the client, assuring and reassuring. An evaluation, we're affirming, evaluating, reformulating if we need to. This is excellent. And remember, I keep saying, you have to be able to take the nursing process and transition it into the different topics we're covering. So this example is the nursing process being looked at through the advocacy lens. Okay. Then levels of prevention regarding case management. Let's go through them. Okay, primary. Use the information exchange process, meaning talking with each other, to increase the client's understanding of how to use a healthcare system and the health promotion strategies that will maintain health. Do we understand why that's primary? Why is it primary? We're teaching, we're trying to increase the client's understanding of how to use the healthcare system, right? To hopefully teach them how to health promotion strategies, right? To prevent them from needing a case manager, developing a chronic condition that requires a case manager, right? Secondary, use case findings to identify existing health problems in your caseload, right? Timely holistic assessments and interventions can slow the disease trajectories. So what are we doing here? Early identification, right? We're trying to find existing health problems that are not out of control yet, kind of slowing the disease process, slowing it up. See if we can, early intervention, early identification, early intervention. See if we can get it under control before it gets to a tertiary, requiring tertiary level of prevention, right? So tertiary, we need to assume that they've already been assigned a case manager for whatever the multiple resources that they may need. Okay, so part of our role may be monitoring the use of prescription medications and adherence to their treatment plan. Okay. Okay, you could read through this section. It's a good section, conflict management, right? Because if you are the coordinator, the case manager, you're going to come upon conflict. Somebody may not agree with you. Somebody may want to take a different path. Okay, so what are some positive ways to deal with conflict management? Well, a couple of words come to mind, which is negotiation, assertiveness, and cooperation. And box 13.6 has behaviors that could be used in conflict management. Accommodating, avoiding, collaborating, compromising. Okay. And the most important one to me is collaborating, because collaboration is what case managers do. So please have a read through collaboration, page 232. Okay. What does collaboration look like?
You're basically meeting with the interdisciplinary team, like the nurses, the doctors, the PT, OT, speech,
Yep.
everyone that involves into that care of the patient.
Exactly. And as nurses, even beyond case management, think about it. To me, collaboration is up there with advocacy, right? As nurses, we are always collaborating. We're collaborating with our patients. We're collaborating with their patients and families. We're collaborating with food service staff, with environmental staff. We're collaborating with everybody. If we have a patient, anything that goes on with that patient, we're collaborating, right? And then as in the last chapter, there can be issues in case management. Okay, and here's that liability we talked about. Liability concerns of case managers exist when the following three conditions are met. Okay, so we had a duty to provide reasonable care. Some kind of a breach occurred through active omission to act. The act or omission caused injury or damage. So again, liability, we could also say malpractice. Case managers must strive to reduce risks, practice wisely within acceptable standards, and limit legal defense costs through professional insurance coverage. So this is important to know, that there are legal issues that potentially could arise, but you have to meet these three. And then this is an interesting box for you to read through if you'd like to, more detail on legal issues, 5 general areas of risk for case managers. And I would actually, I think you could use this outside of case management too, and just call it 5 general risks. Okay. So it talks about liability for managing care, negligent referrals, experimental treatment and technology, confidentiality, fraud and abuse. I mean, I know this box is case management oriented, but there's lots in this box you could take out in general. You could pull out to nursing in general. And then this box is excellent too, 13.8, elements that reduce exposure. And then we also talk about ethical issues again, right? So case managers have their own code of ethics. Okay. And case management ties into the ethical principles of beneficence, justice, non-malfeasance, which is doing no harm, and veracity. So again, this is a little summary from our ethics chapter. Okay. So that's our case management. Then let's go and cover disaster. Disaster management, chapter 14. Okay. You can have a look at the objectives. There's quite a bit of them, but what we know for disasters, so we're in chapter 14 now. We know that disasters are both human-made and natural. Okay, and we need to know the difference between those two. Okay. The cost to recover from a disaster has risen sharply because of the amount of technology that must be restored. Nurses increasingly are getting involved in disaster planning, response, and recovery through their local health departments or local governments. Okay, here's your definitions of, in order to understand disasters, we need to understand what types of disasters that can be. Okay. What are some types? What are some examples of human-made, and what are some examples of natural disasters? Okay. Okay, these are the two we're focusing on, natural and human-made. So what would be a natural disaster?
Hurricane.
Yep. What else? What about human-made disasters? What would be examples of them?
Wildfire.
Fire, yep. Chemical spill,
Corona.
what? there are always ways to prevent or manage how people in their communities respond to disasters. Okay. What are some US agencies, directives, and systems that are included or how part of disaster management? Okay. Here's a list of them. And again, when you go back and compare your notes from these PowerPoints to the study guide starts to limit what we need to know. Study guide starts to point out important pockets of essential knowledge that support us knowing the concept of disaster management. Does that make sense? Healthy People 2020 for disaster management. Okay, what's the cycle of disaster management? Well, first is prevention. Second is preparedness. Third is response. And this outline covers them nicely. And fourth is, where is it? Response. No, where am I at? Response. What's the role? What's our role in a disaster? Advocate. We're the how do we take our ADPI and move it into the disaster management mode? Okay, so advocate, we're going to be doing assessments. We need to understand what community resources are available. We're often the first responder. So look at all the different roles we might be performing in. You know, what if we're in a shelter? What if we would have been assigned to do shelter management? Okay, what's important to know if we're working in shelters? Well, we might be providing assessments and referrals. We're meeting the basic health care needs of clients, getting prescriptions, first aid, dietary adjustments, keeping records, ensure emergency communications, providing a safe environment. The last part of this was recovery, right? So we had, after response was recovery. Okay, recovery is about returning to normal. Role of the nurse during disaster recovery. Okay. So I do need you to review these PowerPoints. Okay. I want to go to the book and point out a few things here. So we're in chapter 14. Okay. There's your cycle: prevention, preparedness, response, and recovery. You have to have an idea of what each of those are. Okay. We need to understand what a disaster, natural or human-made. Have to understand the difference. And here they give you some examples. Okay. Box 14.1 gives you very specific examples of natural and human-made. Okay. What are the organizations that are going to help us in a disaster? Okay. Department of Homeland Security. Okay, is going to oversee everything. Right, but there's some other organizations that are going to help us as well. Okay, the national preparedness guidelines. Excuse me. I want you to know about the national preparedness guidelines, the national response framework. Okay. The national response framework is important because it provides how the community will work together and how the response efforts relate to other parts of the national preparedness. So national response framework is really important. as well as the emergency support function, public health and medical. Okay, so I would make a little card, and we know that the Department of Homeland Security is going to be the organization that oversees these smaller organizations, but they all play a different part. So I've highlighted 1, 2, 3, 4 agencies. And I just need you to have a basic definition of what each of them provides. Okay. We're on page 238. Okay. And for disaster management, in order to understand disaster management, we have to have an understanding of who plays a role in organizing, financial recovery. All these different groups, organizations play a different role. Healthy People 2020 objectives in disaster management are important. Okay, so we'll get to their box in a minute, but we need to know Healthy People 2020 goals and objectives. Okay, and then here's the disaster management cycle and the nursing role. The nursing role in disaster management is very involved. Okay, so it goes through the 4 stages, right? Prevention, preparedness, response, and recovery. Okay, so we know that nurses have skills that enable us to work in all aspects of disaster. Okay, here's your Healthy People 2020. Okay, you've got 4 objectives related to disaster mitigation. If you're asked about this in the exam, the right answer is one of these 4. There's many more objectives that we can develop related to disaster mitigation, but if the exam asks you about it, we specifically want to know what Healthy People 2020 objectives are. Okay, then it goes through each of the stages. Prevention, preparedness, this is important, okay, because as nurses we teach how to be Red Cross ready. How to be Red Cross ready. How do you prepare a family for disaster management? How do you do primary prevention with a family way ahead of time? Okay. This box, I need for you to know this box. Okay, to be able to understand preparedness. Okay, how to prepare a kit with a family, store at least 3 days of food, know where the kit is. Remember to check your kit every 6 months to replace outdated items. Right, talk with your family. Do you have a plan? Do people know where to turn off utilities in the house? Do they know where the fire extinguishers are? Okay. So these 3 steps: get a kit, make a plan, get informed, and the details with them are really important. Okay. Box 14.2, bioterrorism and emergency readiness. What competencies do we need to have? And you don't need to memorize this box, but important to read. You know, as nurses in the community health, public health arena, this is part of our job to prepare a community. This is an excellent box for resources. Websites providing education and training opportunities for disaster preparedness. And I'm assuming in all of your workplaces, you have a disaster plan, right? You probably do drills. You probably know what your role is. You should. Right? volunteer opportunities for disaster work, community preparedness. Okay. We just talked about that. And here's your national response framework that we talked about earlier. This goes into more detail because this this is a primary response. These are one of the primary response organizations. Okay. We need to note the NRF focuses on short-term recovery. It helps define the roles, responsibilities, and relationships critical to effective emergency planning. So this is, yes, it's under the Department of Homeland Security, but this is the big organization that is going to be kind of coordinating the disasters. Okay. This is actually a really good chapter for just general information, right? Populations at greatest risk for disruption after a disaster. Important list to know. Okay. So I want you to have a look at that chapter. We need to know, we talked about natural versus man-made. We need to know about Healthy People 2020. We need to be able to teach families how to prepare, which we just went through. And the importance of the national response framework. Okay. So that's it for, that's it for disaster management. Does anybody have any questions? I need you to be able to articulate the cycle, the four areas of disaster management and what our role is in each of those. Okay. Where are we at? Surveillance and outbreak. I'm not sure we're going to get to all this information. So however, you know how we're covering this. So whatever chapters we don't get to, I need you to at least review the PowerPoint, and then we're going to compare the PowerPoint to the study guide, right? And see what's in there. Okay. And see what we need to know. So why is surveillance important in outbreak investigation? Why is that important? Okay, so disease surveillance has been part of public health since the 1200s, right? State and local police powers also provide surveillance activities. Okay, what are some definitions? Okay, what's a definition of disease surveillance? An event. What's biological terrorism, chemical terrorism? Okay, why do we use surveillance in public health? Here's your answer. It's one of your objectives. We can estimate the magnitude of the problem, determine the geographic distribution of the illness or the outbreak, detect epidemics, monitor changes, detect changes in health practices, facilitate planning. So lots of uses for surveillance in public health. What are the purposes of surveillance? Identify trends and unusual disease patterns, set priorities for utilizing resources which may be very scarce. Right? Develop and evaluate programs for commonly occurring and universally occurring diseases and events. Think about what we've done with COVID over the last 2 years. Development of programs, develop and evaluate programs over the last 2 years for COVID. Collaboration among partners, right? if you're surveilling a particular disease, let's say you have a food outbreak from a restaurant, and you're the person coordinating this surveillance monitoring. Who are you going to be talking with? You're going to be talking with the restaurant. You're going to be talking with employees. You're going to be talking with people of the hospitals, emergency rooms, right? Patients who have gotten sick. It's all part of surveillance monitoring, right? Such collaboration promotes the development of a comprehensive plan and a directory of emergency responses. Right? Nurses are often on the forefront of the responses in their surveillance process. Here's some nursing competencies in the surveillance process. You can read through those. They're on slide 9. Okay. What are some data sources for surveillance? That's what I want to focus on. Okay. How do we get our information? Okay. We have, it's in the book, we'll go to it, but we have different surveillance systems. We have how we report it. We can report it passively, actively, sentinelly, and syndromically. We'll go through that. Okay, data sources for surveillance, death certificate, you can read through this. What are reportable diseases, national notifiable diseases? I know within the schools that we had a whole list of reportable diseases, right? Such as, let's say for preschools, it was chickenpox. We have to report pertussis. We have to report HIV. We have to report, there are certain things that there's a national database of reportable diseases. And then the state has its database. Okay, and here's our types of surveillance systems. Okay, so we'll go through that. How do you do an investigation? Here's the other thing we need to know. Well, we need to know this. We need to know the types of surveillance systems to be able to understand the concept, the topic of surveilling. We need to understand what the systems are, and there are 4. And we also need to understand how it may have happened, how the outbreak may have happened. And the answers to each of these are in the study guide. Okay. Okay. So surveillance right here. Okay. So here is your surveillance systems right here. Okay. Here's your passive system. Relies on healthcare providers' report of existing cases. Here's your active system. Here's your definition of your active, your sentinel, and your syndromic. Okay, so this is definitions. Okay, and then we were starting to cover patterns of recurrence. How does it happen? There's 6 different ways. We need to know this. What is a point source outbreak? What is an intermittent outbreak? What is a mixed outbreak? And this paragraph gives a nice little definition. Okay, what's a propagated outbreak? Okay. And the other thing we need to know, and might as well just stay here, is when we're developing community-based programs, how do we conduct a needs assessment? All right. And we're still in surveillance and outbreak. So when we're developing a community-based program based on an outbreak or surveillance, we have different stages, right? We have to conduct a needs assessment, right? We have a preactive stage. We have a reactive stage, an inactive stage, and an interactive stage. Okay. There's a lot of definitions. Then we have 3 different models of surveillance for program planning. Okay, so we have the patch model, right? So with the patch, we want to encourage the community to act, to participate. Okay, and then the second one is the assessment protocol for excellence in public health. These are models for surveillance. And then we have it's called the MAPP, which is mobilizing for action through planning and partnership. And this focuses on long-range planning. So a lot of definitions here. Systems, patterns of occurrence, when developing programs, how do we do a needs assessment? What stages are there? And then the 3 different models for surveillance. Okay, so that's a quick review of the surveillance chapter. Okay. I'm going to stop there. I know we didn't get to, we'll cover it in the reviews, or we'll cover this information in the reviews this upcoming week. But we have 3 chapters. We have program management. We have managing quality and safety. And we have nursing practice at local, state, and national levels. So here's what I would suggest. Let me stop sharing. Here's what I would suggest: to do exactly what we've been doing. Go through the PowerPoint, pull out those areas, first I would go through the PowerPoint. Then I would go to your study guide, see what sections on the study guide are in the study guide related to the chapter, and then pull those parts out. Okay, because I use the study guide as well today to teach the topics that I taught, trying to narrow it down. Does that make sense? Because we don't have to know everything about every chapter. Okay, and as I've told you before, the study guide is an excellent indication of the essential knowledge you will be responsible for understanding all these different chapter topics and concepts. Does that make sense? So I need you to do your part as well. And I'm sure this is a lot of information provided today. And if you didn't read up or prepare for any of it, I'm sure it's overwhelming. But again, go use the study guide as your basis of studying. Okay, so now you have both last week and this week. Other than the last 3 chapters, everything in the study guide we should have covered to some extent, or at least the topic. You're going to have to go in and pull out 16, 17, and 28 and do your own legwork on that, just like we've done with all the other chapters from last week and this week. Anybody confused, or does that help, or what are your thoughts? Anybody?
It makes sense.
It was helpful.
Okay. And if you follow the same process that we're doing, I took my notes from the study guide. I try to point out areas that are essential knowledge that you need to understand. Okay, and you're going to have to do that for the last 3 chapters. Okay. Can somebody, or we need to pull up, let's everybody go to the attestation. Okay, what are the 2 types of disasters, and give an example of each? So what are the 2 types of disasters?
Natural
Natural
and
man-made.
man-made.
Okay, and give an example of each.
Natural,
Natural is like
hurricane,
hurricane,
man-made
earthquake.
chemical spill.
Okay. Second question is ethical principles. Just go into the study guide here. Okay, what are your ethical principles? What are they?
Autonomy, malfeasance.
Yep. Remember,
justice.
you have ethical theories and you have ethical principles. The theories are the utilitarianism, the deontology, the distributive justice, and consequentialism. Okay, but what are your principles? You have autonomy, beneficence. What else?
The distributive justice.
That's a
and-
theory. What are your principles?
I'm looking on page 54, box 4.1, and it says ethical principles, and those is what's listed. So I'm
Okay.
confused.
Okay, so go ahead and read those. Okay, go ahead and read those.
It's the autonomy, the non-maleficence, the benefits, and the distributive justice.
Okay, okay,
Wow.
okay. What page is that on?
It's on page 54, box 4.1.
Okay, so read those for us. Autonomy. What else? Distributive justice, autonomy. What is the other one? Non-malfeasance. And what's the other one?
Justice.
We said that.
The benefits one.
Hang on. What page are we talking?
Page 54.
That's our theories. Okay. And here's our principles. So autonomy, non-malfeasance, beneficence, which requires that we do good, and distributive justice. Okay. So I need to change the study guide to reflect that. So thank you for pointing that out. Danielle, real quick, what did you need to point out on the study guide?
Oh, it was it was in the cultural influences in nursing, and it was the very last bullet point on the study guide
Okay.
that clients who are
Yep,
Hispanic
yep.
expect direct eye contact.
Okay.
And
Okay.
in the book,
Okay.
it had that.
All right. Got it.
Something different.
I just highlighted it. Okay.
Yeah.
I'll take a look at that. Okay. Okay. A lot of information. Do you guys have a roadmap? a good roadmap that I suggest would have been in the announcement I posted yesterday. Okay, I kind of gave you a step-by-step, whether you want tutoring or not. I gave you a step-by-step of how I think that you should go about preparing for the exam. For those of you that have read it, do you agree with that? Or what are you thinking? Does anybody know what I'm talking about?
Yeah,
Yeah, it
I'm
was a good breakdown.
to the study guide and Kahoots.
Yeah.
I'll try Kahoots this time for sure.
And we already talked about this at the beginning, but those two Kahoots are really, really, really good. So my roadmap from yesterday is hopefully would be my strategy to study. And if now you do have legwork to do because of the 3 chapters we didn't get to. But after you do all that, and if you still don't understand areas, because this exam covers a lot of content, okay, from multiple chapters, then schedule a time with me this weekend. I'll put out some times and we'll go through it. But I really want you to try and attend a review, or at least listen to the recordings. We tried to spread them out Thursday, Friday, Saturday, Sunday. So try and attend a review. And then just real quickly going forward, next week is exam week, which is 9, week 9. Week 10, we're done with lecture. Okay, so after today, we're done with all the chapters. So week 10, what we'll be doing is HESI reviews. Okay, so our class time will be a HESI review. So everybody's required to come to class in week 10, and we'll do a HESI review, but we're also going to give you the opportunity to attend anybody else's lecture as well that week. So we'll just post all the sections, but you are going to be required to attend your own lecture in week 10, but you can go to other lectures as well. So that's kind of a whole week of review. Okay, so that's week 10, and then week 11 is HESI. I already had somebody email me about, they said that their peds in their community HESI are on the same day, and that they wanted to change the community date. Just so you know, I don't have anything to do with scheduling the HESIs. Okay, you would need to go back to your campus dean and work through that scheduling. Okay, so does that make sense?
Last semester this happened to all of us as well. And
okay, what was the outcome?
So the teachers provided a day that they had maybe another class, and like, okay, maybe